So talk a little bit about, and I'll give this to Liz and certainly Jodi
Yeah.
engage as well. The impact of the federal legislation and the role of state legislation, just again, because we're in this voting season, what should folks look at? How important and where does state impact this issue in comparison with federal legislation? Excuse me.
Yeah, good question, because the two interact and are really key to meaningful advancement of women's health. So, on the federal level, they can set policy around Medicare, for example, and that, a visit to a doctor for menopause symptoms, getting I don't know whether it's HRT or device or whatever, that is actually covered by Medicare. So that would be a federal issue. On the state level, you could have, like we were talking about earlier with breast cancer, the screening. You could require that private insurers in the state, you could require Medicaid in the state has to cover that screening. So there's definitely a role for federal and state. And I think a good place to start is what does the state do they have mandates on coverage for certain services in women's health, whether it's the diagnostic screening side or the treatment side? Is there even like a women's health task force or some women's health committee within the Department of Health for the state? And also, how can you get involved in that, right? They must have public meetings, so you want to shape that. You want to look at any regulatory activity in the state. So I do think that there is definite ways to look for engagement and indication of dedication to women's health on that state level, and then talk to your state legislators. Even if they just hold hearings addressing some of these issues, that raises a lot of awareness. You get media coverage. So there are different things that can be done state level, not just federal level.